of if the person is suffering from goiter, rowdy mutti gland che, okay, this much big, and you want to remove some of the part, just imagine, okay, you have to think, your parathyroid is normally functioning. Do you want to remove it? Will you remove it? No. So whenever you are doing a surgery, this anatomical aspect also you have to think in your mind, that at that time you have to take care of parathyroid also, preserve it. Whenever you are doing any surgical aspect or something, you are excising some of the part of thyroid, think about that also. So, that is one part. Second part is recurrent laryngeal nerve. You know the vagus nerve. Okay, pure parasympathetic. We learned it when we were talking about sympathetic and parasympathetic. Your 10th cranial nerve. So, obviously cranial nerves are coming out from the above and going down and supplying your most of the thoracic and abdominal vagus nerve, if you remember. Okay, so the part, one of the branch of vagus is this recurrent laryngeal nerve. And the name of this recurrent, why it is called recurrent? Because when the vagus is going down, this nerve, which is branch from it and going up, taking back route. And that is why the name is recurrent. Okay. And it is moving, or you can say going up, parallel to the lateral aspect of the thyroid. Lateral aspect of the thyroid. So another important thing that you must remember while, or you can say applied aspect of this thyroid situation, that is at C5 and T1 level. Another is going up, that is the recurrent laryngeal nerve which is going up. Another important, as the name larynx. I told you where the thyroid is situated. Where? Below larynx. And larynx is your, if in a layman terminology, what I would say, voice box. Okay, laryngeal nerve, that means related to something that, okay, so if while doing surgery, if recurrent laryngeal nerve is damaged, then the vocal cord may be paralyzed. And that is why another important aspect that you must remember while doing surgery of thyroid, that is, apart from parathyroid, try to save this laryngeal nerve, recurrent laryngeal nerve. Okay? Another important thing about, just you will learn this in your anatomy classes, that, see, both the laryngeal nerve, if you can see this yellow color one, both are not same. Both are taking different routes. Anatomy people will tell you in detail about it, but just see the roots of laryngeal nerve. This is your vagus going down. This is right subclavian artery, and this right recurrent is taking a curve from right subclavian, whereas the left one is taking from your arch of aorta. So on both the sides, you have different routes of this recurrent laryngeal nerve. On the left side from the arch of aorta, okay, and on the right side subclavian. Okay, so this is also a beauty of recurrent laryngeal nerve that you should remember. So this is anatomical aspect, we will not go in detail. Blood supply, you will be taught in detail about it in your anatomy classes, that superior thyroid artery and inferior thyroid artery, that is from the external carotid, and subclavian artery will, in anatomy classes, will be taught. Now let us go a little bit inside. This gross anatomical aspect is over. Now let us go in detail of physiological aspect, where we are concerned right now, how the thyroid hormone is synthesized. Let us talk about that. The structural and functional unit of thyroid is thyroid follicle. Like this. If you see thyroid, there are small follicles are there. And these follicles, they are structural and functional unit, just like in kidney, nephron, just like in CNS, neuron. So same way, in your thyroid, you have a follicle, which is structural and making a structure, and your hormones, they are synthesized in it. Another important thing that you should remember, thyroid is the only hormone that can store its hormone. And another important thing, that is, for 3 months even, For 100 days supplies, thyroid can have the thyroid hormone into it. That means if you have a 5-6 days of iodine deficiency, you are not taking, I will go for iodine deficient diet. Then don't worry, your thyroid will take care for 100 days, for 3 months, because it has a store. It is the only hormone, only gland which stores the thyroid hormone for 100 days, 3 months supply. See the beauty, because nature was knowing that these fellows may have a deficient diet, may eat something, may not eat something. Let me give this important hormone which is responsible for physical growth, which is responsible for mental growth, which is responsible for autonomic also. Okay, which is automatically going to control the functions of the body. So you have a 100 days supply, or rather you can say vaguely 3 months supply of the thyroid. So storage is also there, and that store is inside this follicle, this color one. Okay, that is nothing but the store of your thyroid hormone. Okay, so this is the structural and functional unit which is follicle, and this follicle is containing the secretory substance which is called colloid. This one. Okay, so over here it is the supply of the thyroid hormone is stored, and whenever the requirement is there, it will be secreted. Normal amount will be secreted in your body. Okay, and trying to control all your anabolic actions. Thyroid is anabolic hormone. Okay, so we'll try to control all your anabolic activities, metabolism. Most of the metabolic activities are affected by thyroid. Remember this. And whenever you want to learn anything about any gland, any endocrine system, always think about their functions first. One should go backward. Okay, think about the function, then try to see how these functions are affected. Then you will be able to understand that functional aspect of the, or everything about that particular endocrine gland. Okay, any damn gland you are talking about, whether it is pancreas, whether it is adrenal cortex or anything. Okay, so that is the colloid, and they are lined by the cuboidal epithelium. This epithelium is also changing its shape also depending on the activity of the thyroid. Depending on the activity of the thyroid, the cells which are lining this colloid, which is surrounding this colloid, or you can say the making a follicle, is also, the shapes are also changed depending on the activity of the thyroid. If you can see over here, this one, when the thyroid is hypothyroid or the functioning is less, see the shape of the cell. They are low cuboidal or squamous. And whenever the hyperthyroid or the thyroid is too much active, see the shape of the cell. They are colloid being reabsorbed, they have become low columnar or cuboidal. So the shape of this cell surrounding follicles, they are also changed. Okay, this is logical. When the thyroid is inactive or not functioning, obviously, do you think this colloid will go out? Is going out? No. That means it will be stored, and for storage you are giving him the space. That could be logical understanding. And when the thyroid is hyperactive, so most of the colloid, or you can say the hormone, will be going out. So you have a less colloid. So cells will have a room to become columnar. Okay. So this is the shape which can be seen. This is histological picture. That this one is colloid, thyroid colloid, and these are the cells which are surrounding it. Okay, over here another one like this. So what is there in the colloid? What is there? Obviously our store, thyroid hormones. Okay, thyroid hormones, but how it is stored, that is a beauty. That is a beauty. So major constituent of the colloid is thyroglobulin. Thyroglobulin is a glycoprotein. Okay, so it is one of the storage, you can say, protein on which the thyroid hormone, they are scaffolding, or you can say enapper, they are hanging. Your thyroid hormones are hanging on this thyroid globulin molecule, which is having other amino acids also. Okay, and one of the constituent of them is your thyroid hormone, whether it is T3 or whether it is T4. Okay, around 6,60,000 molecular weight. It is usually seen as a dimer, that is 330 kDa is there. And as I told you previously also, you have a 3-month supply or 100 days supply of the thyroid is there in your thyroid gland. Okay, thyroglobulin, as you can see this pass stain and showing you this pink one, these are all your colloids. Okay, which is ultimately staining the carbohydrate component of this pass stain. For carbohydrate staining it is used. So you want to see how much thyroglobulin is there, and depending on thyroglobulin you can come to know how much is your hormone is there. Okay. So there are two major constituents of this thyroglobulin. As I told you, your thyroid hormone is situated into it. Okay, that is T3 and T4. Okay, T3 and T4. T4 is tetraiodothyronine. Okay, and T3 is triiodothyronine. Your 93% of the secretions from the thyroid hormone is T4. It is T4. Only 7% which is secreted from thyroid is T3. And metabolically active is T3. Okay, and T4 is converted into T3 at the cellular level. That we will discuss in next sessions. How the thyroid is moving in your body, how it acts, or you can say metabolic action, mechanism of action of thyroid. Okay, TSH is controlling, that we have discussed previously. As I told you when we were talking about PTH, parathyroid hormone, that on the posterior side you have 2 and 2 on this side. You have parathyroid gland. Para. I told you that you remember this word para. Same way, these follicles are there, structural and functional unit of your thyroid. Okay, structural and functional unit of thyroid, that are follicles. Just parallel to that, between the follicles, you have certain different cells present. We call them parafollicular cells. Parafollicular cells. And these parafollicular cells, they are also called C cells because they are seen clear. They have clear cells and they are not touching the follicles. They are parafollicular, this one, C cells. C means they secrete calcitonin. Okay, parathyroid hormone was secreted from parathyroid gland. And calcitonin is secreted from C cells. C cells, C means clear. C cells, and they secrete calcitonin. C cells, they secrete calcitonin. Parathyroid was increasing calcium level or decreasing calcium level? All of you are saying, some say increase, some say decrease. Increase and decrease, tell me. Increase, yes. So PTH increases your calcium level. So calcitonin, as the name itself, calcium, so it decreases calcium level in the blood. Okay, no increase. I remember it like this. Calci, that is your for calcium. TO, put it down, and no increase. NO, no increase. Calcitonin. Okay, so calcitonin decreases your calcium level. PTH is increasing your calcium level. So the important part situated in your neck related with many functions. Okay. So as I told you, it antagonizes the PTH action. Again, this one is, the arrow is showing you your C cells. Again, immunoperoxidase stain showing you your C cells. This is not important right now for you. So let us talk about the synthesis. As I told you, the important aspect that you must know while treating the hyperthyroid patient and even hypothyroid, that is physiological mechanism, negative and positive feedback mechanism, that aspect that you must know. So let us go that. So what we talked about, first we talk about anatomical aspect. Okay, then we talk about structural and functional unit, that is your follicle. Okay, that is your follicle. Follicles, they are having cells surrounding it. Okay, surrounding it. And your hormone is inside that follicle. Inside that follicle. So this follicle is getting hormones inside it. How? That should be your first question in your mind. First question in your mind, how it gets this hormone inside the follicle? How this hormone is synthesized into it? The question should, obviously, being a medical student, as I told you every time, you should always ask yourself, how and why? How it happens, why it happens. Nothing in your body is without any purpose. Without any purpose. Okay, you take a tablet, then you get a side effect, it is because of you took a tablet. But your physiological actions, remember, your physiological actions, always ask yourself why and how. And go behind it until you get the answer. To understand the subject better. Now you must have, I am talking about colloid. Then you should think, when I say thyroglobulin is there inside the colloid, and when I say that T3 and T4 are just hanging on it, we call it a scaffolding. The word which is used in your book is scaffolding. And if you literally see the meaning of scaffolding, you will see it means hanging. Fasino machado kahiye na apne, like that. So, how it happens, that should be your question. And when I talk that you require iodine, how this iodine will enter inside? You are eating over here, it is taking a route through esophagus into your stomach. It is going up to here and entering in your thyroid. This iodine. So see the importance of iodine also entering. And another important thing, when we talk about sea level and going away from the sea level, thyroid belt of India and all, just see, this thyroid is the only gland or hormone which is using this micronutrient, or you can say trace element called iodine. Not any other gland is using micronutrient or trace element. Iodine it is important, it is must. And that is why the government of India or all over the world, in 100,000 parts of the salt, that is sodium chloride, you have 1 part of iodine. 1 lakh part of salt, you have 1 part. That much amount is required. That much amount is required to synthesize this important hormone. This is trace element. And another one is your tyrosine. Okay, tyrosine we discussed in our autonomic nervous system, if you remember. DOPA and all. Remember it or not? Okay. So, this is the structural and functional unit. So, we'll discuss this. Now, as I told you, thyroid is coming into it and it is stored. It is stored over here. Okay, that means there is something over here, that is thyrocyte. Thyrocytes, they are synthesizing this thyroid hormone. You must be thinking then how this iodine is coming inside. Iodine is obviously you have consumed. It has gone in your stomach, absorbed in your blood. It is there. Now when this blood, as I told you, richly supplied. We saw in our previous slide, richly supplied thyroid gland. One of the adrenal cortex may be the exception, but richly supplied, blood supply. Okay, so when the blood is passing through this, surrounding this follicle, this iodide, it will be taken. Or you can say another word it is used, it is iodine trap. This thyrocyte or thyroid cell will trap this iodine. Okay, so it will come inside. So one part you have got. Another one is your thyroglobulin. So it's a protein. So you can make it into your cell. You have endoplasmic reticulum, you have Golgi apparatus. So thyroglobulin you can form, tyrosine. Amino acid is also there. So this raw material you have to take. And how it is synthesized. So we'll talk about this cell. Okay, this one is your blood supply. This is your thyrocyte, where the things are happening, and this is the colloidal aspect. So this 3 stage we will discuss. Okay, so iodine will be or you can say it will be trapped, will be over here and will go into this place, and your protein or glycoprotein that will also enter, and here the T3 and T4 will be formed in your colloid and will be stored also. So you require two main principal component, that is your tyrosine amino acid, and it is provided from the, as I told you, glycoprotein scaffold. Okay, that is thyroglobulin. Remember, thyroglobulin is not containing tyrosine only. It contains other things also. So wherever the tyrosine is there, your thyroid hormone will be formed. Okay, so this one is your one thing which is there. Okay, some different books are giving different numbers. Some says 140, some says 134. One thyroglobulin molecule contains 134 to 140 tyrosine molecule or amino acids. Okay, and another important constituent is iodine or iodide. It is taken into your cells, into your thyrocyte, that is in the form of iodide. Okay, and as I told you, it is called iodine trap. This mechanism is called iodine trap. And another important thing, just imagine a follicle, round follicle. Okay, inside you have a colloid. So if this is a cell, the cell must be having two sides. One which is facing the colloid, one which is facing the blood side, or you can say interstitium, where your parafollicular cell is present, where your blood supply is there. So there are two sides of the thyrocytes, and this is called polarity of thyrocytes. This polarity is always maintained in case of thyrocytes. Any thyroid cell will have this polarity will be maintained. That means the function which is done on this side, we call it a basal side, which is towards the interstitium. And the colloidal side is called apical side. The side which is facing the colloid, we call it a colloidal apical side. And the side which is facing the interstitium or blood vessel side, we call it a basal side. This polarity is always maintained in the thyroid. Remember this. And the functions are also fixed on that side. So the function which is taken place by the apical side will not be seen on the basal side. And the function which is seen on the basal side will not be seen on the apical side. So your basal side, what do you think? What it should do? Iodine trapping. Because you have consumed iodine. It has been in your blood. Okay, another important thing. Whatever iodine you consume, only 20% will be there in the body. 80% will be gone in the urine. Okay, trace element, as I told you, micronutrients. So whatever you have consumed, out of that 20% will be trapped. That is on which side of the thyrocyte? On the basal side. Remember this. This polarity is always maintained in the follicles, or you can say in your thyroid. Okay, so on the basal side you want to trap the iodine. Now this iodine will go inside the cell. There is a specific mechanism for that, and we call it, in your general physiology, all of you must be knowing symport and antiport mechanism. Okay, so the mechanism for this iodine trapping is called NIS. NIS, these are all your pre-PG questions, NEET PG questions. They ask these small things in your NEET PGs. What is NIS, how it is affected, and something like that. Small MCQs. So NIS is sodium iodide symporter. You know what is symporter? Both are going in the same direction. Okay, so sodium is two sodiums and one iodide, both are going inside the cell. That is the first step of iodine trap. Okay, we discussed this thing just in the beginning, so I'll not go in detail of that. But yes, sea fish, or you can say sea water, as I told you, biggest reservoir of your iodine. Okay, vegetables that are from the soil where you have a good amount of iodine. Himalayan belt, that is iodine deficiency because far from the sea, and daily intake, as I told you, 20% you require. This one is our Himalayan belt. Sub-Himalayan goiter belt is the world's most intense goiter endemic region, affecting nearly 120 million people. As I told you, this is just a trace element, micronutrient, this one is the level that you require, and that is why out of 100,000 part, you require 1 part of your iodine in your salt. Okay. Now this iodine is, you have to take it inside. Okay. You have to take it inside, and for that you have a pump. We call it a NIS, that is sodium iodine symporter, or NIS. This is also called iodine trapping. The thyroid cell having a resting membrane potential is of around minus 50 millivolt. You must be thinking how it is this minus 50 millivolt is achieved. You have your sodium potassium ATPase pump. It is constantly working into it, sending 3 sodiums out. Okay. And you have this minus 50 millivolt is maintained. And because of that, you require sodium's help. Okay. To send this iodine inside. Okay. So with the help of the energy of the sodium, this iodine will go inside. And remember another thing, because it is this is a charged one. So it cannot cross this lipid membrane. And that is why it requires a pump. Okay. It is not iodine. It is iodide which is entering. Okay. This is iodide which is entering. So NIS will send this iodine inside the cell. So your first step is over. You have got your iodide into the cell. Thyroid cells, or you can say thyrocyte. Okay. This iodide will move from your cell into the colloid by the protein called pendrin. So iodide has come inside the cell. Now this iodide will have to go into the colloid from the cell. So for that also you require a protein called pendrin. Okay, so here you have NIS, on this side you have pendrin. Okay, why I am telling you this polarity? Just in the beginning I told you about the polarity, that you require a polarity. There is a polarity, fixed polarity of the thyrocyte. It is always fixed. On this side will function this side will function this. This is always maintained in case of thyroid. Unique gland, storing the hormone for 100 days, for 3 months, unique. Using trace element, unique. Okay, unique polarity. Otherwise, we talked about cell membrane. The definition of cell membrane, when we said it is fluid mosaic model, if you remember. Okay, so as I told you, we will not discuss about this, but we have talked about this, that if we have certain foods, we call it a goitrogens. Okay, we'll discuss when we'll talk about applied aspect. Okay, so this is the NIS, iodide and sodium, they are going inside, and this iodine then will go into the colloid by pendrin. So this is happening over here, not over here. This is your basal side and this one is your apical side. So NIS will transfer sodium and iodine. Okay. The proposed structure, if you remember our growth hormone receptor, it was how many times it was passing through the cell membrane? 7 pass. We call it a 7 pass receptor or serpentine receptor. Same way, this receptor proposed, this pump is having the 13 pass. Okay, it passes 30. It is the proposed model, having 3 glycoprotein on the extracellular side. Okay, so this is what we have discussed till now. This one is thyroid, this is your follicular cell, iodide, they are entering inside by NIS, and from here it is through the pendrin going into your colloid up to this. Okay, so this one is NIS sending your iodine into your cell, and this iodine will go from here to here into your colloid by pendrin. Another important things to remember, iodine deficiency and iodine excess both inhibit thyroid function. See beauty, iodine excess is also not good, iodine deficiency is also not good. Both are affecting your thyroid function. Okay. This we will discuss when we will talk about Wolff-Chaikoff effect, when we will talk about the applied aspect. This NIS is also seen in other places also. Like your mammary gland, salivary gland, stomach, and even colon. Okay, NIS is not only seen in the thyroid but in mammary gland also. And it is said that because it is present, this importer is present in the mammary gland, it leads to secretion of iodine in the milk. and which is probably important for thyroid function in the neonates. Okay. So, how the iodine is there in the milk, maybe because of the presence of this NIS and sending this iodine into the milk. This is one of the source, and that is how the iodine is available through the mother's milk. This is an applied aspect when we talked about hyperthyroidism. When we say that hyperthyroidism, you want to stop the secretion of or synthesis of thyroid. So for that, one of the steps is iodine trapping. If you stop iodine trapping, do you think thyroid will be, hormones will be formed? Yes or no? No. Isn't it? So, let us stop that. One of the part. Let us stop that. So, there are certain drugs. That is, we call it monovalent anions, like thiocyanate, chlorate. They compete with iodides. And because of that, iodine will not be available for the synthesis. This is the simple treatment of hyperthyroidism. See, we are thinking what should be given. You stop that part. You step first part, essential. As I told you, one of the essential element for the thyroid hormone synthesis. By giving this drug, which will compete with the iodide, and this transport into the thyroid will be stopped, and you have no thyroid, so hyperthyroid can be treated. See the steps where you can apply your applied physiology or your pharmacology. That is why I am telling you, whenever you talk about pharmacology, think about physiology. And in medicine, both physiology, pharmacology, and along with pathology, your medicine will be clear. Understand? And there are certain metabolic poisons like cyanide. They also inhibit this function. TSH, obviously. TSH, thyroid stimulating hormone. It is logical. Should increase your thyroid's hormone secretions. So the formation should also be more. So should increase your iodine trapping. Okay. Two situations are identified in the humans where this iodine trapping will have a problem. Or their symporter is having a problem. There are inactivating mutations in the symporter gene, leads to congenital hypothyroidism. If there is a mutation in the gene of this particular symporter, then this symporter will not be able to function, then the person will have a congenital hypothyroidism. There is a defect in this level only. That trapping level is defective. Okay, there is a mutation in the gene. And another one is Hashimoto's thyroiditis, where anti-symporter antibodies are also seen. Antibodies against these symporters are seen, and we call it Hashimoto's thyroiditis. Okay, and you have autoantibodies against this symporter. Obviously, you have the antibodies against this symporter will not be able to trap the trace element, which is essential to form triiodo, tetraiodotyrosin. So your thyroid hormone will not be formed. You don't have iodine available. Okay, and that is how this antibodies will lead to the deficiency in the thyroid hormone. So these are the steps that this picture is from your Guyton. So most of you will be able to correlate in your books that these are the steps we are going to discuss in detail. Now it is there. This iodine is now inside the cell. Via pendrin it is now inside your colloid. Now here only one enzyme which is going to work. Here only one enzyme which is going to work, which is having many legs. I always say it is having many legs. Peroxidase. Having many legs, peroxidase. Okay. So there is an enzyme which is important for the synthesis, which is, we call it iodination, we call it organification, we call it coupling. All these you require one hormone, one enzyme. That is peroxidase, which is there at the apical membrane of the thyroid. It is found in the apical membrane of the thyroid. Remember, thyrocytes. Okay? Clear? So now the cell is having iodide into it. Pendrin is sending iodide into it. Your thyroglobulin is also synthesized in your thyrocyte, which is going out into the colloids. Now colloids are having both the things available. Both the things available into it. Thyroglobulin and your iodide. Now you just have to fix them. You have to fix them. You have to make an organ. I say you have to make an organ. So one of the terminology that you will encounter is organification. We call it organification. These are all terminologies you will have to remember. Organification, then coupling, all these things. Okay, so there you have to make an organ of the thyroid hormones. And this organ, we call it organification. Okay, so these are the steps that you will have to remember. There are 7 steps. Okay, so this NIS sending your iodine inside, pendrin sending your iodide over here into the colloid, and you form your thyroglobulin, which is now over here in your colloid. So now you have to fix both these things, this iodide and thyroglobulin over here, and we call it iodination. Okay, because this iodine is going to attach to the tyrosine, and we call it iodination. Okay, and this iodination then will have a coupling, and will have a T3 and T4 hormone. If there is a defect in the pendrin, also lead to syndrome. See, at every step we have a disease. At every step, if something is not functioning, you will be having a disease. If something is not functioning properly, you have a disease. Your NIS having problem, you have a disease. Your pendrin, if there is a problem in the pendrin, you have a disease. We call it a Pendret syndrome. Okay, here the pendrin is, there is a mutation, not able to do its function, and lead to defective organification of the iodine and leading to goiter. When the iodide is accumulated inside the thyroid and will lead to increase in the size. Now, thyroglobulin, as I told you, will be formed in the endoplasmic reticulum. Golgi apparatus will refine it and will send it into the thyroid follicles. Okay, that we have discussed. Tyrosine, this is the basic biochemistry. I will not go in detail of it. But before going into detail of it, why I am showing you this tyrosine is this structure. Remember this 1, 2, 3, 4, 5 and 6. Okay, this place is important for thyroid hormone synthesis, 3 and 5. Okay, so remember this places 1, 2, 3, 4, 5 and 6. Where the iodine is going to attach. So remember 3 and 5. This blue one is your thyroglobulin. So these 3 steps, that is important for the synthesis, or you can say the formation of thyroid hormone. The first step is oxidation of iodide ion, iodination of tyrosine, and you call it organification of thyroglobulin, and storage. Storage is the last one. As I told you, 100 days supply is there in your thyroid hormone. The first step is oxidation of iodide ion. Now this iodide ion is oxidized, okay, into the nascent iodine or I3, which is capable of attached to the tyrosine molecule. Again, which place? 3 and 5. 3 and 5, a place of your tyrosine molecule. And another important thing, as I told you, in your colloid, you have only one enzyme which is going to act. Which enzyme? Peroxidase. Okay, so wherever you find, you speak peroxidase. Okay, so here it is promoted by peroxidase, which leads to oxidation of your iodide. Okay, and this peroxidase, if it is absent, obviously the rate of hormone synthesis will be 0. Iodine is not available, I can't do anything. I require raw materials to make something. Okay. This peroxidase, again, hyperthyroid, remember. Hyperthyroid patient, you want to reduce the formation of thyroid. Thyroid peroxidase and coupling enzyme which forms T3, T4 are competitively inhibited by anti-thyroid drugs, that is carbimazole. Okay, so this peroxidase is inhibited by another drug, that is carbimazole. Okay, so another drug you have where we have thiocyanate and all. Okay, So these are the places or physiological steps where the thyroid hormone synthesis can be stopped and you can treat your hyperthyroid patients. Okay, hyperthyroid patient. And again, TSH will stimulate. TSH was also stimulating your symporter, NIS. So again, TSH is stimulating. This part is also. So THS role is clear. TSH role is clear. So we have found two places where you can use the drugs to treat the patients of hyperthyroidism. Okay. So this one is the peroxidase where you have iodination will be there. So this one is your thyroglobulin molecule where tyrosine is there. 1, 2, 3, 4, 5 places. 3 and 5 is important. Remember this. And in this colloid, your iodine will go and attach. Now, as I told you, you have to form the organ. You have to form the organ. This thyroglobulin is there in your colloid, having tyrosine. As I told you, many amino acids will be there. Remember this. Only tyrosine is not there. Many other amino acids are also there. So wherever the tyrosine molecule is available, there you go and attach your iodine. There you go and attach your iodine. So here you have tyrosine, here you have tyrosine, here you have tyrosine, here you have tyrosine. All these are your tyrosine molecule. Now you have iodine available. Again the same enzyme, thyroid peroxidase, and will go and do the organification of this tyrosine molecule. The binding of iodine with the thyroglobulin molecule, it is called organification of thyroglobulin molecule. You are making an organ. You are making an organ. Organification. Okay. So in tyrosine molecule, if one iodine is attached, we will call it monoiodotyrosine. Okay. Monoiodotyrosine. If two iodine is attached, we call it diiodotyrosine. If 3 iodine is attached, we will call it triiodotyrosine. And if 4 iodine is attached, we will call it tetraiodotyrosine. Remember another important thing. Thyroglobulin will not have only T3 or T4. Thyroglobulin will have MIT also, that is monoiodotyrosine. It will have DIT also. Okay, and it will be taken back into the thyrocytes. Okay, this is important concept to remember. So this one is tyrosine, iodination at 3rd place, and we call it monoiodotyrosine. Okay, and if at 3 and 5 position iodine is attached, we call it diiodotyrosine. If at 3 places, 3, 5 and 3 dash, then we call it triiodothyronine. And if at 4 places if it is attached, it is tetraiodothyronine. Another important concept to remember. When I told you that thyroid is secreting T3, thyroid is secreting T4. And I told you another one also. Reverse T3, yes. So reverse T3 is also secreted. What is that? What is that? Whenever you say how T3 is formed, how T4 is formed, how T3 is formed. Or let us first talk about how T4 is formed. You can see over here. In the last line. 2 DIT will combine. DIT plus DIT. They will form T4. They will form T4. And to form T3, MIT, that is monoiodotyrosine plus diiodotyrosine or thyronine, sorry. Okay. So you have to say MIT plus DIT. Remember this. If you say DIT plus MIT, it will form reverse T3. You understand what I want to say? If you say, sorry, this we will discuss later on. If you say DIT plus MIT, it will form reverse T3. Remember this. It is inactive. It is not going to act on your cell. It is inactive thyroid. So our body will always form DIT plus DIT T4, MIT plus DIT T3. And very few, or you can say rare, DIT plus MIT. Okay. So DIT plus DIT is clear to you. You can remember. But you will get confused with MIT or DIT. Right now you may remember. But when you go out of the class, you will forget. कि सर ने क्या बोला था, MIT आएगा या DIT आएगा पहले. All of you want to do MD? All of you want to do MD? M पहले आएगा, D बाद में आएगा ना. तो MIT plus DIT. DM नहीं करना बहुत. DM की सीट्स कम है, बहुत कम है. तो DIT plus MIT. I don't reverse T3. Don't want to do. MD हो जाओ बहुत है. Okay, clear? So your DIT plus DIT, your T4. Your MIT plus DIT, your T3. Your DIT plus MIT, your reverse T3. So all of you want to do MD. So MD तो clear हो जाएगा ना? कि नहीं करना? बहुत हो गया. First MBBS हो जाए तो भी बहुत है. हाँ? इतनी बड़ी बड़ी बुक्स, कौन सी बुक है? इंदु बेन, इंदु खुराना. Good book. So, is it easy to remember? Clear? So, DIT plus DIT is your T4. This one. See, 3, 5, 3 dash, 3, 5 dash, T4. Your MIT plus DIT, your T3. And your reverse T3. See the structural difference between reverse T3 and T3. Okay? Clear? DIT plus MIT. Here your MIT plus DIT. Do not forget. Ever. नींद में से भी उठा के रूम पार्टनर पूछे क्या है रिवर्स T3 तो क्या बोलोगे? I don't want to do. It is rare. This is rare species. It is inactive. It is inactive. So, another important thing you remember, as I told you, you have a maximum secretion of T4. Maximum secretion of T4. Okay. So your 35% or you can say 30 to 40% is T4. 7%, 8% is T3. Okay. Very trace amount is reverse T3. Okay. And these are also there in your thyroid gland. That is MIT and DIT. That all will go inside your cell. This is, right now it is formed in your colloid. Remember, अभी तो हम colloid के अंदर ही बैठे हैं. हमने आयोडीनेशन किया, हमने नेसेंट आयोडीन बना दिया I माइनस से, वो हो गया. We have made an organ, thyroglobulin, where at many places tyrosine was there. I made MIT, I made DIT, I made T3, I made T4. ये पूरा मेरा हो गया thyroglobulin. पूरा तैयार है, मेरा organ तैयार है. This is organification. Okay? And everything is done by only one hormone, one enzyme. Peroxidase. Many legs. 1000 हाथ હોય છે ને? We have many hands, our goddesses. Here peroxidase. Many places, many legs. Okay? So, this MIT plus DIT is clear. T4 is clear. So, functions of peroxidase, whenever you are asked, remember OIC. That is oxidation, iodination and coupling. Coupling is this one. Coupling of tyrosine. This is also by peroxidase. Okay, this is also by peroxidase. Remember, OIC. Peroxidase, functions of peroxidase, OIC. Okay? Clear? First one is your oxidation. That is for iodine. Iodination, MIT, DIT. And you make a couple. शादी तो करवानी पड़ेगी ना, बच्चा बड़ा हो गया है. MIT and DIT. Clear? DIT and DIT is not clear. But MIT, DIT feasible. DIT, MIT feasible. કજોડું કહેવાય ને એને તો. હા? Very trace element, rare. So clear of peroxidase function, and in this whole activity is being performed where? Colloids. Thyroid follicles, structural and functional unit of thyroid. Okay? So this is the summary of your activity. Iodide, inside, iodine, okay, thyroglobulin, MIT, DIT, MIT, DIT, T3, DIT, DIT, T4. They are into your thyroglobulin, and now your hormone is ready. आपका ट्रक तैयार है. It is lodged with your T3, T4, MIT, DIT. कचरा भी साथ में आएगा. DIT, MIT भी बोलेगा मैं भी जाऊंगा बाहर, है ना? उसको भी बाहर जाना है. ले जाएंगे, हमें कहाँ आना है? We will bring him back out, but not out of the cell. Cell तक ले जाएंगे. चलो यहाँ तक घुमा के आते हैं. So what cell will do? What thyrocyte will do? Thyrocyte will trap this thyroglobulin molecule, which is having T3, T4, MIT, DIT also. Okay? उसको साथ में ले जाएगा अंदर. बाद में उसको अंदर जाके पीटेगा, कूटेगा. उसमें से T3, T4 निकाल देगा. T3, T4 को बोलेगा तू मेरे काम का है, तू बाहर जा. You go in the blood. You go in the blood. और MIT, DIT उसमें से उसको कूट के iodine or tyrosine, I will not send them out. These are important elements to form another thyroid. You go back. You go back into colloids. So this is the root of thyroid. You made your thyroid into thyroglobulin. Organification has been completed. It is now this truck is lodged with T3, T4, your MIT, DIT. Okay, into your thyroglobulin. Now it is ready to go into the cell, and from cell into the blood. Okay, I told you about polarity. What is the polarity of thyrocyte? Yes? ऐसे ऐसे करने से थोड़ी चलेगा. मेरा लेफ्ट हैंड ये काम करेगा, राइट हैंड ये काम करेगा. ये है polarity. This part is the basal side will bring iodine. This part is the apical side will bring thyroglobulin. Clear? So now, this is the last step that we will discuss. So this is clear. This is also very simple to remember. 7 to 8% is, you can remember 8% T3. 8% of your secretion is T3. So 3 plus 5 is 8. T4. 35% is T4. 8%. 8 अगर आपको गाइटन से लग रहा है तो 7 बोल दो. 7% is T3. So 3 plus 5, 8. Clear? So ये हो गया. ये दोनों साथ में रहेंगे. 23 and 33%. MIT, DIT. DIT ज्यादा बनेगा. Another very important concept to remember. Just imagine, if you are taking lot of iodine in your diet, what do you think? What will be formed more? T4 ज्यादा बनेगा या T3 ज्यादा बनेगा? अगर आप iodine ज्यादा ले रहे हो तो क्या ज्यादा बनेगा? क्या बनना चाहिए? T4 की T3 बनेगा ज्यादा. T3 वाले कितने हैं? T4 वाले कितने हैं? Hush. Thank you. Yes, you are right. T4 will be formed more. आपने जितना आपके पास आयोडीन है तो वो जाएगा अंदर. It will be used for organification. Used for organification. You will try to form more and more organs rather. That should be clear. If you are consuming less iodine, then T3 will be formed more. आपके पास ज्यादा नहीं है तो आप क्यों बनाओगे T4? Understand? So this is a basic logical explanation of that. So this should also be clear to you. Storage will be there for 2 to 3 months that we have discussed again and again. Now we will never forget कि थायराइड के लिए हम 2-4 दिन आयोडीन नहीं खाएंगे तो भी चलेगा. 100 डेट का स्टोरेज बना के दिया है स्टोर हाउस. So these are the steps that we have gone up to here. You have T3, T4 and MIT, DIT, something like that in your thyroglobulin. This drug is ready now. Now this drug has to go inside and then go into your body. Okay? So release of T3 and T4 from thyroid gland, thyroxine and triiodothyronine must first cleave from the thyroglobulin molecule. अभी उसको मैंने बोला ना, कूट कूट के निकालना तो पड़ेगा ना. आप पूरा थायरोग्लोबुलिन बॉडी में डाल दोगे चलेगा? ब्लड में नहीं चलेगा. So what you will do? You will take them, bring our mehman. You are my mehman. You are my guest. Come inside the cell. So to get anything inside the cell, you have only one procedure. What is that? Endocytosis. Pinocytosis rather. Okay, ये तो small है. Pinocytosis करोगे आप. You take these thyroglobulin molecule inside the cell from the colloid. So your thyrocytes will trap this thyroglobulin from the colloid. So small colloids will be trapped. Again back into the cell. Okay. See this one. They are trapped into the cell. This yellow color one is your hormone. Okay. This is thyroglobulin. It is trapped. Endocytosis. See the apical side and this is basal side. Remember this. Apical and basal functions are fixed. तेरा काम ये है, तेरा काम ये है. तू मेरी काम में टांग नहीं अड़ाएगा, मैं तेरी काम में टांग नहीं अड़ाऊंगा. Something like that. So it is going to trap this and now it is inside the cell. आपका first internal में question था, organelles of the cells, lysosomes. Now the lysosomes will come in action. They will attach to this vesicle and will digest all this material. Hormones will be released going into the interstitium and from their interstitium going into your blood. आपके blood में आ गया. For this trapping also you have a protein. For thyroglobulin you have a receptor called megalin. See, we have NIS first, we have pendrin, we have megalin, and we have peroxidase. These are 3-4 numbers you remember. Your thyroid synthesis is clear. These 3-4 things. और कौन कहां पे रहेगा वो याद रखना है. उसको यहां से यहां मत लाना. पहले ही बोल दिया. Polarity is fixed for thyroid. Unique one. Storing your hormone for 3 months. Required trace element. Another uniqueness. You can palpate it. Another uniqueness. Surgery में एक केस आएगा. ये भी uniqueness हो गया. Okay. C5 to T1. ये भी uniqueness हो गया. Okay. So, the megalin on the apical surface will lead to pinocytosis, as I told you. It is pinocytosis. Don't say exocytosis. Be more specific. Lysosomes, digestive vesicles will be formed, and through the multiple proteases, one of them is catheptase. Okay, one of them which is important, it is catheptase, which act on this peptide bonds. And will release T3 and T4 and will be released in your body. So now your synthesis of thyroid is over. 5-6 things are important to remember. These are the 7 steps you have to remember. Organ बनाना है, iodination करना है. Okay, organification, iodination, coupling, MIT, MD करना है, DM हाँ करना है लेकिन कम लोगों को करना है. So DIT plus DIT, MD, MIT plus DIT, that is okay. 8%, 3 plus 5, 35%, clear. 23, 33, clear. Okay. These are your amount which is there in the thyroglobulin. I think most of the things are clear for thyroid. Okay. So this is the summary of your thyroid one. The whole, whatever we have discussed, we can discuss on this also. Okay. So, your this iodide, it will diffuse, okay, it will diffuse going into the thyroglobulin. Again, pinocytosis, digestive vesicles, T3, T4 will be released, and as I told you, MIT, DIT आए हैं, उसका कुछ काम नहीं है. You will send them back. Other amino acid like tyrosine, iodide, you send them back. Okay? So I think this is the end. This is the end of this. And along with that, we have discussed applied aspect also, where the drugs can act. 2 जगह पे काम करेगी. एक आपका सिम्पोर्टर को देयर इज अ प्रॉब्लम इन द सिम्पोर्टर, उसको अफेक्ट करेगी, तो भी आप थायराइड हार्मोन सिंथेसिस कम करोगे. यू कैन स्टॉप दैट. यू कैन अफेक्ट द पेरोक्सीडेज ऑल्सो. ओके, सो लेट अस एंड हियर. डिस्कनेक्ट.